Hi, everyone. Welcome to today's event. I'm Tatiana Ferguson, co-founder of the Black Queer Youth Collective, a grassroots group for Black, queer, and trans youth here in Toronto. Beyond my work with the BQYC, I am an equity and inclusion specialist who have worked extensively with several community organizations and all three levels of government to develop policies and programs that respond to the needs of 2S LGBTQ Canadians. In my work, I often talk about SEEDS. SEEDS is an acronym that stands for Share, Explain, Examine, Discuss, Suggest, Solutions for Change, and that's what we will be doing here today. Today's featured presentation will be reflections on challenges and opportunities that arose during the pandemic and how we can use those lessons learned during the pandemic to better support queer and trans women in the LGBT sector and in programs and services more broadly. These lessons are based on my observations and insights from the BQYC COVID-19 Assistance Project, which was an emergency response project for Black individuals who were seeking support due to job loss and unemployment during the pandemic. So starting with our first lesson, the first lesson that I have learned in my work during this pandemic has been to embrace change. As many of you are aware, the COVID-19 pandemic had brought on a lot of changes, and it was important for us to adapt our programs and services to one, comply with the mandated requirements to prevent the spread of the COVID-19 virus, but also to ensure that we were still providing services to our community. Within the BQYC, we adapted our services to ensure that youth that we work with were well supported during lockdown. We embraced change by transforming our drop-in group, which was an in-person drop-in group, into a web series, and then subsequently introducing our emergency relief program as previously described, the BQYC COVID-19 Assistance Project. Other organizations may have also taken a similar approach by modifying their services, delivering options, or introducing new and innovative programs to respond to unforeseen challenges brought on by the pandemic. Another lesson we learned was to be adaptable. The pandemic caused many organizations to think creatively about how we offered services, how these services would be administered in compliance with the mandatory emergency orders, and how we continue to support our communities that were seeking support in a virtual space. Additionally, organizations had to adapt their work protocols to ensure staff was equipped with technologies to work remotely. Equally as important as access to the technologies was developing protocols to ensure that client information, much of which would be sensitive information, was protected during the service delivery model virtually. While some people may have experienced little challenges working from home, others may have struggled due to privacy concerns, lack of familiarity with some of the new online software, and challenges with facilitating the services virtually. Within the BQIC, we had to be very strategic about how we promoted our COVID project to ensure that we were reaching our target audience. The BQIC, as mentioned, works primarily and almost exclusively with Black, queer, and trans individuals. Our primary audience, however, is youth who are between the ages of 16 and 29. However, during the pandemic, we had extended that. We've made conditional provisions for folks who were over 29 due to the lack of services for Black LGBTQ folks more broadly. We also introduced virtual group guidelines to ensure that our online meeting space was as safe as possible and accessible to individuals who was interested and wanted to participate in our virtual group discussions. So the second lesson was be adaptable. The third lesson is to consider access needs. So in addition to creating guidelines for our online space, it was important that we considered and inquired about what participants' access needs were. We opted for an online program that was interactive, which allowed for multiple ways of engagement via chat, audio, or video. Additionally, we encouraged participants to rename themselves and add their pronouns to their names so that we were not misgendering individuals during our virtual programs. These were some of the steps we took to ensure that we were making our space accessible and inclusive for trans folks, trans and non-binary people who access our virtual program. Our records, however, also showed that 2/3 of our participants in our COVID assistance project actually identified within the trans spectrum. So it was important that we clearly communicated different ways participants can engage in our space due to some of the discomforts that may arise for trans and non-binary folks when engaging in programs in general, but particularly in virtual programs where their gender may not be as clearly defined or described. The fourth lesson was for us to be mindful. And I encourage service providers to continue to be mindful in how you do your work with communities across Canada and across the world. During the series of lockdown, research data showed that communities of color were disproportionately affected by the virus. However, despite the high rates of infections in Black communities, issues raised around efficacy of the vaccine rollout and how it would affect access to programs in the future. This had resulted in a lot of hesitancy within the Black communities, and this is something we are continuing to be challenged with as we are continuing to offer programs and services to our communities. There's still a lot of hesitancy with taking the vaccine and also discomforts with having to card or ID folks to access our services. Many youth and individuals that did access our services, however, was negatively impacted and described the mental health impact as one of the greatest concerns or impact that they had during the lockdown. Furthermore, Black Canadians experienced additional stressors due to reports of high infections within our communities. While it is easy to dismiss the issues and concerns around vaccine hesitancy despite the high levels of transmission in Black communities, it is important to be mindful that when offering support to communities that have experienced multiple forms of oppression, that everyone is at different places in their life and everyone has different comfort levels. Organizations should approach their work from a place of empathy and compassion, as many queer and trans folks are often dealing with multiple issues, and these issues are both systemic as well as social. The fifth and final lesson that I observed and I learned during this pandemic was to be intentional. While clients may have different needs, service providers must work to reduce barriers for queer and trans people who are in need of help and support. It is important that your organization reflect on how you are currently working and strive to make your services accessible by being intentional in the way you design your programs and services. It's also important to be intentional in how you promote your projects. If you're going to be inclusive of communities, you have to ensure that those programs and services reflect what communities' needs are at any given time. These needs can change over time. So, what has worked a few years ago may not necessarily work now. And this is the first time for the millennials on the call. This is the first time millennials would have experienced a pandemic. And so, there were a lot of changes in terms of how folks adapt to this new reality of engaging in programs and accessing services. So those are the 5 lessons that I've learned and observed during this pandemic through my work with the Black Queer Youth Collective's COVID-19 Assistance Project. As a reminder, those lessons are 1, embrace change. 2, be adaptable. 3, consider access needs. 4, be mindful. 5, be intentional. That concludes today's virtual session, and I welcome any questions or concerns you may have in regards to this presentation. So I'll take some time to just browse through the chat to see if there are any questions or comments. Okay. So I don't see any questions or comments, but you can feel free to reach out to the Black Queer Youth Collective for more information about our COVID project by visiting our website, www.blackqueeryouthcollective.org. And you can email us using the contact form there. So I will be ending the live, and thank you so much for having me.